Hello and welcome to today's Spotlight on Services. We'll be talking about respite care. My name is Simone Nizell, and I'm the Education and Outreach Coordinator at Del Oro Caregiver Resource Center, one of two CRCs involved in bringing you today's program. I'd like to introduce the other participants in today's program. And I'm going to turn it over to my colleague at Passages CRC, Jessica Milker.
Hi, thank you, Simone. I'm glad to be back here with you today. I'm Jessica Melcher, as Simone said. I am the education specialist for Passages Caregiver Resource Center, and we're delighted to offer another educational lunch today.
And now I'd like to introduce one of my colleagues at Del Oro, Gain Saturn. Gain?
Hi, good afternoon, everyone. Thank you all for joining us today. My name is Gain Saturn, and I'm the Director of Programs and Clinical Services at Del Oro Caregiver Resource Center. I've now been with Del Oro for approximately 8 years and counting. And in terms of caregiving, in the past, I have supported my grandmother with dementia. And so caregiving is very personal to me.
Thank you so much for that, Gain. We're going to turn it over to Mary Ann. Mary Ann, again, if you could introduce yourself, tell us how you're affiliated with the CRC system and any personal experience you have with caregiving.
Okay, I'm Mary Ann Schuyler, and my husband had a stroke in 2012, and so I've been his caregiver for 11 years, and I live in Chico.
Great. Thank you so much, everyone, for being on the call today. We are excited to jump into the program. Jessica is going to be moderating the discussion. Really, this is an opportunity for all of us to just learn a little bit more about respite, how it works for the caregiver, and how the CRC, your local CRC, can help facilitate respite on a caregiver's behalf. So with that, I'll turn it over to Jessie.
Thank you, Simone. Yeah, it's great. I can't see who's on the line, but I'm glad you're here to learn about respite care. I know that term can be unfamiliar sometimes to folks. So, Gain, I turn it over to you. What is respite?
I think the simplest way to under respite means to take a break. So if someone is telling you you need respite, essentially they're telling you to take a break. Respite is designed to provide temporary relief for a short period of time so that the primary family caregiver can take a break from their caregiving responsibilities and duties in order to receive some essentially relief and rejuvenate so that they can go back into providing care again for their loved one. And respite can come in the form of in home care. It can be also outside of the home, such as adult daycare or short term facility stay.
Thank you, Gain. And I love the word that you use, rejuvenate, right? We all need to recharge and reset sometimes as caregivers. I know I've taken care of my parents on and off the last couple years. So can you tell us, Gain, how clients can utilize respite through the Caregiver Resource Center system?
Absolutely. Clients, if they're eligible, so I would encourage you to connect with your local caregiver resource center and identify what county you're in and which CRC site that you are actually located in, and then they can help you determine eligibility. Once eligibility is established, you will be connected with a family consultant, and that family consultant can explain all the services that are provided, and one of them being respite. And so, family caregivers can access respite services with individuals that provide the support, such as vendors that we contract with. And again, I'm really speaking on behalf of Del Oro Services. It is best to connect with your local CRC agency to get more information.
Great, Gain. And can you elaborate on what those requirements for eligibility are?
Yes, and to be eligible for services, and again, I'm speaking more on behalf of Del Oro Services here. And so typically, essentially, you would need to fit into two categories. You are either providing care for a loved one over the age of 60 and is considered frail, meaning they need assistance with two activities of daily living. So that could be like bathing, dressing, grooming, toileting, showering. Any two of those can qualify for services. And then another way to qualify for services is if you're caring for someone over the age of 18 that has sustained a brain impairment or a cognitive impairment.
Yeah, so there's certain requirements or an assessment to go through. I know we spoke about that in our last spotlight on services during the family consultation role. So thank you, Gain, for that information. Yeah,
Exactly.
and
Thank
I
you.
yeah, and I want to mention Marianne has been a client with Passage's Caregiver Resource Center for a while now. So Marianne, how does respite look like for you in your in your caregiving role?
Well, it gives me a break. I use it several times a month. And when I let someone else take over for a while, I can get a breath. I can take a breath, and it gives me time to fix a little bit of my mental health and not be so stressed. I can go to church activities. I can visit with friends. I can go to the park or the gym, or I can just sit quietly and meditate or stay home and take a nap.
That's wonderful. And I think you hit it on the nose there about taking a breath and your mental health. Can you tell us a little bit how that respite helps you kind of regroup and have your mental health stay stable in your caregiving journey?
Well, we all need a break. As caregivers,
Yes.
it can be very stressful, and it's, task after task. And most jobs, they have their weekends, evenings, holidays, and caregivers don't get that. And so we need to be able to replenish ourselves. And so I'm a better caregiver when I come back because I've been allowed to regroup and do some things for myself that don't involve my loved one. So
That's
I
great.
think and it just lets us be better at our caregiving job and helps us stay mentally healthy.
That's great. Thank you, Marianne. And how often do you use it? Is it weekly, monthly? Can you elaborate on that?
About 3 times a month, I'll use it for a few hours, and it gives me time. If that's enough time for me.
Yeah, I think that's great. It's I know we have clients that we hear in support groups share that they've gone to the point where they're burnt out. So
Mhm.
utilizing something on a routine can help manage the stress and prevent burnout. Would you agree, Marianne?
Oh, absolutely. Yeah. Yeah. When I first started caregiving, and um, I didn't know where to turn, and we just got advice from other people, and I reached out, and Passages was just a lifesaver with their giving me respite so I could get away because I was ready to throw myself off a cliff. So yeah,
Well, I'm glad you called Passages.
yeah, I'm still here.
Yeah,
So yeah, it's been wonderful. Best thing.
great. So
Just a
Gain,
quick
how
reminder, Jesse, before we move on, for those of you in the audience who have questions, please feel free to drop them into the chat and we'll address them at the end of the program. Take it away, Jesse.
Thank you, Simone, for that reminder. Yeah, pop in your questions there in the chat if you're tuning in on YouTube or Facebook. So I wanted to ask Gain, as a family consultant, how would you facilitate respite on behalf of a client?
Yes. And so family consultants do help coordinate services for the client, specifically respite services. And so typically you would connect with your family consultant. We would provide you different options depending on your respite choice. And so, again, respite can come in the form of in home care, it can be adult daycare, it can be short term facility stay, and it depends on your CRC site. So I encourage you to, of course, look at what is offered at each site location. And if you look at the bottom, you can visit our statewide CRC site to locate again your local CRC. And so essentially, we provide the information to clients, and then after the client selects a vendor of choice, we would go ahead and verify the services and complete additional paperwork as needed.
Great. And Gain, I know we get calls, people looking for, long-term care in the home. Can you walk us through what the short-term respite means in under
Yeah.
through the caregiver resource system?
Absolutely. As mentioned, respite means to take a break. And if clients are experiencing caregiver burnout, if they're experiencing compassion fatigue, this respite is meant to essentially nip that right away and allow the client to rejuvenate and refresh so that they can continue to provide care for their loved one.
Great, thank you. And Gain, would you agree that this is that through the caregiver resource centers, when the client is connected to the family consultant, they can get guidance and help navigation of putting interventions for self care. So then they're not having to like kind of backpedal and prevent the compassion fatigue.
Absolutely. Once you're connected to a CRC site, one of the things that we do provide is a specialized caregiver action plan. And in that caregiver action plan, we typically will identify some goals. And many of our clients will have goals on there for self care. And a part of that self care may be introducing and utilizing respite services and or other community programs or support that will be helpful to them to prevent that burnout.
Great. Yeah, I know with the statewide caregiver resource centers, people can go to the website to get in touch with their local centers. So, whether you think you may be eligible or not, one way to find out is get connected with your local caregiver resource centers. So, thank you again for that information. And I want to turn it over to Marianne again. You mentioned, Marianne, that having respite allows you to breathe and, get reconnected with your mental health. So, how has respite changed your caregiving experience, knowing what you know about that now?
Well, my attitude is a lot better because with respite, I know I can plan on being able to get away. And so then I have the break. And then when I come back, my attitude is a lot better. I'm a better caregiver. I'm more patient and kind. In our caregiving journey, sometimes we can get a little grumpy and irritated and impatient. And so it's having respite is one of the best things as caregivers that we can do for ourselves. It's essential. So it's made me better.
I'm glad to hear you say that, Marianne, because I think when we first get calls from family caregivers, they're so focused on caring for their loved one, right? That they don't think that they need to take time to care for themselves as well. So I think I'm glad you pointed that out because it is essential, as you said, because we know that caring for your loved one is a marathon, not a sprint, and it's critical to take care of yourself, if not more probably than your loved one. Would you agree, Marianne?
Yes, and it that doesn't happen right away because as women, we think we have to do everything. And it wasn't immediate. It took me a few years to realize that it's okay to put myself first. It's okay. It's like when you're on the plane and they say you get your oxygen first so that you can take care of other people. and it's kind of the same thing. So it's okay to think about yourself first in this case.
Right.
Thank you.
Jesse, do you mind if I insert with a question, a
Oh,
clarifying
please do.
question?
Yes.
So Marianne is describing using in-home respite care, but Gain had mentioned adult day programs earlier. And Gain, I was wondering if you could elaborate and tell us a little bit about what an adult day program looks like for those on the call today who might not be familiar with it.
Yes, absolutely. And I enjoy adult daycare programs a lot. And essentially, it is an outside of the home care. Typically, it can start as early as 8 o'clock a.m. in the morning, and they can run as late as 5 p.m. to 6 p.m. into the evening. But it is essentially a day program, and it provides socialization and recreational activities to individuals that are experiencing cognitive impairments. However, it really just depends on the daycare program, as I've seen a variety of different patients that do enroll that have different symptoms too. But again, essentially, it's to allow your loved one to go there, receive that recreational and socialization, to kind of continue to help stimulate their mind.
Excellent. And there at many adult day programs, there are congregate meals as well and nutrition. Is that
Yes.
correct?
Yes,
Okay.
that is correct. So typically, meals are provided, at least lunch, and I know there are snacks that will be included as well throughout the day. There's also assistance with personal hygiene, specifically with toileting, if that is something that the participant is needing in the program.
And Gain, I know here locally for the adult day program, they also help with medication management. Is that correct? To your knowledge?
I will say yes and no. There are certain requirements. So there is a difference between adult daycare and adult day health care. So I do want
Okay.
to make that distinction. So adult daycare, they can provide medications, but they cannot provide, for instance, insulin. So if there are no available trained med techs on site, then essentially medications would not be included in the program. So I think it does vary from program to program. And so I always go back to, definitely check in regarding what services are being offered with each individual adult daycare program. And I did mention adult day healthcare. That one specifically do have medical staff, and so they do offer any type of medical support that is required for that patient.
That's a
Great.
helpful
Thank you, Gain.
distinction. Yeah.
Yes. Yeah. And I actually learned something new right now. So thank you, Gain.
You're welcome.
Yeah. I just want to remind our audience, anyone who's tuning in, feel free to enter any questions or comments you have in the chat box. We're ready to take any questions. Um, and in the meantime, while let's see if we get any questions, I want to ask Gain, what do you tell any clients that are maybe hesitant about respite, or maybe they say, well, my loved one doesn't want anybody in the home, or they don't want to leave the home?
I definitely always encourage the clients to think about their own health. Essentially, they are the glue that is holding everything together. And we want to focus on the family caregiver, and allow them to take a break so that they can continue to do what they're doing. And so, if a client is expressing feeling overwhelmed or just needing a break, we definitely encourage them to consider it, and let them know that it's a trial. It may not be perfect, but their health and well being is so important that we definitely still want to give it a try, and hope that, in return, that they do benefit from receiving that respite.
Great, thank you, Gain. And hopefully, I think that answered our question here from GNA about tips for helping parents accept respite care, because they stubbornly insist they don't need any help from other than their family members. So I think those were some good tips, Gain. And I had a client share with me that what they told their loved one was, just like we need a break from work, we need a break from our responsibilities at home, right? So, and having somebody come in can mean that they're helping the actual caregiver, which in reality that is the case. So, thank you, Gain. And from Janelle, we have a question on how can I prepare to have someone come in to provide respite? What do they need to know? Gain, do you want to take this question?
Absolutely. Typically, when you start respite services, if you're using a vendor, let's say you've decided to choose the in home respite care provider, you will go over different tasks and essentially anything that you're needing in the home while the person is there. And so it's kind of discussed ahead of time. Of what tasks will be implemented while that respite provider is in the home. And so, I would recommend having a task list and kind of checking it off or having it available, especially if we don't have a consistent caregiver coming in, to print out this checklist, have it available, and then that way you can prepare the person coming into the home kind of what your needs, and kind of what you expect them to assist with while they're there.
Great, thank you, Gain. And from Luba, hopefully I'm pronouncing that correctly, a question, can you address the cost of respite? So Gain or
Yes.
Simona, yeah.
I can take it.
Okay.
So if you're talking about like general respite costs, so it really varies. It depends on really the need of your loved one. Some clients will have, the care receivers who do not, sorry, loved ones who do not need that much care. And so it may not cost as much per month. But generally, if you're talking about in home care agencies, at least for Del Oro clients, it can range as low as $30. And I say that's low, but that's, that's a significant amount, $30 an hour to as high as 38 to even $40 an hour. So on average, if you're wanting 24/7 care, I, can estimate easily that it may be over $6,000, $8,000 a month.
Yeah. Thank you, Gain. Go
And to
ahead, Simone.
clarify, and just to clarify, Gain, and I know we're not speaking, I know you can't speak for the entire CRC system, but generally, CRCs can help to offset the cost of respite care, correct? Or subsidize
Yes,
it.
for a short period of time.
Yes.
The CRC systems, of course, depending on the time of the year, the funding that's available within each caregiver resource center, we will be able to provide some respite. And ideally, it's meant to provide short-term respite. So unfortunately, at this time, we don't have the capacity to provide ongoing, yet we work with clients to provide the respite that we can within our agency and then also refer them out to other resources in the community that may be able to supplement some of those care costs too.
Thank you. And we have a question for Marianne from Janelle. So Marianne, would you have done anything differently as you brought in respite to support with the care of your husband?
Would I have done anything differently? I'm not sure what that question means, but I don't think I would have done anything differently. I was grateful for the help that came in, and my husband has a lot of needs that the respite workers, they're not able to take care of him. He can't go to daycare because he just has too many needs. Just getting the break. And I mean, in that instance, I wouldn't have done anything differently at all. I would have still reached out to get the help so I could have a break. I'm not sure I answered that question correctly, but that's that's what I got.
Thank you, Marianne. And you do bring up a good point. I know we're coming up to our a half hour here, but I want to expand on just a little bit on what Marianne was saying on the needs. That there are the vendors that we're connected with don't do any medical care. So, for example, wound care or even administer medications. So, vendors that well, I'm speaking for Passages on behalf of Passages, but the vendors that we're connected with, they do more personal. Um, like hygiene, meal preparations, things like that, supervision, reading, serving as a companionship. So nothing that's skilled medical. That's under a different umbrella. So I just wanted to make that clarification. Um,
Yeah.
and as we're wrapping it up here, I just want to ask Marianne, is there anything you would tell another caregiver about the impact that respite has had on your well-being?
Well, uh, without respite, I would not be so calm. It's just, it's like I said before, I know I can plan on getting a break. It's not like maybe a week from Friday, maybe I can, have a few minutes to myself. I can arrange it. I know they're coming, and I can plan something for my mental health, and so that's a really good thing.
Thank you, Marianne. And Gain, is there anything you would tell a client that's maybe hesitant on, doing this for themselves?
I definitely will encourage you to get support sooner than later. Respite is so vital. If you're experiencing burnout or compassion fatigue, if I was a doctor, your treatment that I would prescribe or um, you know, essentially in terms of medication would be respite. And so really the treatment to caregiver burnout and compassion fatigue is respite. So I strongly encourage you to definitely consider it.
Thank you so much. Well, I appreciate Gain and Marianne. And Simone, I'll turn it over back to you.
Thank you, Jessica. Thank you so much for moderating today's discussion. And again, a big thank you to Gain and Marianne for sharing your collective wisdom about respite. As we come to a close, I just want to pull out some nuggets from this conversation. Um, really, just underscore the fact that respite is an important part of self-care. Respite allows the caregiver to be intentional about their self care, going back to what Marianne said, that she can schedule things. She knows when in-home care is coming, so she can take care of herself, and she knows when and how. Um, and I want to underline too that respite is one piece of this puzzle. One of the reasons why we're doing Spotlight on Services as a series and looking at all of these different services the CRCs provide is to indicate that it really does require a plan and a suite of wraparound services to support the family caregiver. Respite's a big one, and I know that the cost of respite can often deter people, but I think it's important to recognize that the CRCs are here as a resource to you to help you navigate all of that. Um, Family consultants are really important allies in figuring out the best way to incorporate respite into your particular caregiving situation and in a way that is amenable to your given financial circumstances. And I hope that today not only were you able to glean, clear definition of what respite is and get a snapshot of how it's at play in one caregiver's life, but again, just to understand how this piece of the puzzle can be really important in your overall well-being and your overall caregiving journey. So, with that, I just want to invite everyone on the call again today to make sure you check out your local CRC. Please visit www.caregivercalifornia.org to find your local CRC. And if you want to hear more client or caregiver testimonials, including some about using respite, please be sure to visit this website as well. Once again, a big thank you to Jesse for moderating, to Gain and Marianne for your time today, and we will see you all next time for our next Spotlight on Services. Thanks.